Welcome back to the deep dive. Today, we're plunging into a topic that, well, for so many people, feels like wading through treacle diet in type 2 diabetes mellitus or T2DM. If you've ever heard advice that's vague, maybe contradictory, or just plain overwhelming, you're definitely not alone. Our mission in this deep dive is to cut through all that noise. We want to extract clear, practical, and truly evidence-based insights. We've sifted through a stack of reputable sources from the British Dietetic Association and Diabetes UK to the British Nutrition Foundation, NHS.uk, and patient.info. The goal: to give you a concise, high-yield understanding of how diet actually impacts T2DM management. Okay, let's unpack this.
Yeah, it's a vital discussion, and you're right, clarity is so often the missing ingredient. Just to set the stage a little, type 2 diabetes mellitus is a condition where the amount of glucose, sugar in your blood becomes too high. This happens because your pancreas either isn't producing enough insulin or your body isn't effectively using the insulin it does produce. That's what we call insulin resistance. It's really paramount to understand that lifestyle and nutritional support aren't just optional extras. They are absolutely foundational. Foundational for managing blood glucose levels, significantly reducing cardiovascular risk, and preventing those long-term complications associated with T2DM. And just a quick but really important reminder, this deep dive is for educational purposes. Always refer to your local and national guidelines for clinical application. And please consult with a registered dietitian or your healthcare team for personalized advice. That's crucial.
Absolutely. That initial eat healthy advice often feels, well, just too vague, doesn't it? If someone is just starting to tackle their T2DM through diet, what's the single biggest lever they can pull? The one that offers the most profound, maybe immediate change, almost like a game changer.
Right. Well, the overarching goal, of course, is always going to be controlling blood glucose and minimizing cardiovascular risk. That's number one. But what's truly fascinating here, and something that's really reshaped our understanding recently, is the potential for type 2 diabetes remission. For individuals who are living with overweight or obesity, achieving a significant weight loss, we're talking specifically around 15 kilograms.
15 kilos, that's about 33 pounds, right?
Exactly, about 33 pounds. Achieving that, particularly quite soon after diagnosis, has actually been shown to put T2DM into remission.
Remission, wow. For many listeners, that might sound almost too good to be true. Or maybe they might confuse it with a cure. Can you clarify what remission really means in this context? That's an excellent point to clarify, definitely. Remission doesn't mean cured in the way we usually think of it. It means your blood sugar levels fall below the diagnostic threshold for diabetes and stay there for at least 3 months, importantly, without needing diabetes medication. This can drastically reduce, sometimes even entirely eliminate, the need for medication. And beyond that, even if someone doesn't achieve full remission, that level of weight loss profoundly reduces the risks of cardiovascular heart disease, which, as you know, is a major concern for anyone with T2DM. It truly is a transformative possibility for many. But, and this is critical, it's absolutely crucial to discuss suitability and safety with a registered dietitian and the broader healthcare team first. It's not something to just try on your own without that professional guidance.
That's a really profound takeaway. The potential for remission, it really shifts the perspective on managing T2DM, doesn't it? But, okay, with so many conflicting ideas out there about what kind of diet is best, I hear everything from strict keto to veganism. Does the evidence point strongly towards one particular approach to achieve this kind of impact?
It's true. The dietary landscape can feel, well, pretty overwhelming. And while many dietary patterns have been explored and suggested, you mentioned some, like low carbohydrate, high fiber, low glycemic index diets, even carbohydrate counting. The Mediterranean-style diet, or perhaps an equivalent healthy eating pattern that's adapted to personal needs, it consistently demonstrates the most robust evidence. Evidence for effectively managing glucose levels and supporting overall heart health. Its benefits are seen again and again in studies.
Okay, the Mediterranean-style diet, that's the leading evidence-backed approach then. So what does that actually look like on a plate? What are its core principles? And importantly, how might it be tailored for someone living with T2DM?
Right, so based on the sources, a Mediterranean-style diet emphasizes several key things that directly benefit T2DM management. It means significantly reducing salt intake, aiming for less than 6 grams a day. That helps manage blood pressure, often a link issue. You'd aim for, say, 2 portions of oily fish per week. Think salmon or mackerel, for those heart-healthy omega-3s. A major focus is on eating more whole grains, a wide variety of fruit and vegetables, fish, nuts, and legumes or pulses. These are all rich in fiber, which is great because it helps slow down the absorption of glucose. That leads to more stable blood sugar levels.
Less of those sharp spikes and crashes.
Exactly. Conversely, it advises eating less red and processed meats, which tend to be higher in saturated fats. And significantly reducing refined carbohydrates and those sugar-sweetened beverages, they cause rapid glucose spikes. You're also looking at replacing saturated fats, like butter, with healthier unsaturated fats, olive oil, rapeseed oil, and strictly limiting trans fats. Again, that's all with cardiovascular health in mind. Alcohol. Well, moderate consumption, less than 14 units per week, can sometimes fit, but honestly, often it's best to reduce or avoid it altogether. Now, this brings up a really important point. While the Mediterranean diet is highly effective, it's not, a rigid one-size-fits-all prescription. We know diet is deeply personal. It's influenced by individual preference, cultural traditions, access to certain foods, even economic factors.
Sure, makes sense.
So the real power lies in adapting these principles with professional guidance. This is where a registered dietitian becomes so valuable. They can help you create an individualized plan, a plan that integrates these evidence-based principles in a way that genuinely works for your life, your circumstances.
That sounds incredibly balanced, and it's so important to hear that it can be personalized. But okay, when many people think diabetes diet, carbs often come to mind, usually with a lot of fear and confusion. Let's tackle that head on. How do carbohydrates really affect blood glucose, and what should our listeners understand about them?
It's true. Carbs are often center stage in the diabetes conversation, and rightly so. But the fear can sometimes overshadow the facts. The fundamental thing to grasp is that all carbohydrates, whether they're starchy or sugary, they break down into glucose in your body. And glucose is your body's primary energy source. We usually categorize them into starchy carbs like bread, rice, pasta, potatoes, yam, plantains, and sugary carbs found in things like biscuits, sweets, chocolate, jams, sugary drinks. We should also mention natural sugars in fruit, that's fructose, and milk, lactose, though these are often in higher concentrations in dried fruit and juices. The crucial point, though, is that all types of carbohydrate will increase your blood glucose levels to some extent. Many people find that spreading their carbohydrate intake throughout the day and just being mindful of the overall quantity helps significantly in controlling blood glucose.
Right, so it's not just about if you eat carbs, but what kind and how much matters too. Can you give us some vivid, maybe surprising examples of their impact on blood sugar? Because sometimes that abstract idea of carbs isn't as impactful as seeing a concrete comparison.
Absolutely. Concrete examples can make all the difference. The glycemic index, or GI, is a helpful concept here. It basically measures how quickly a food is digested and raises your blood sugar. Low GI foods, absorbed slowly, lead to a more gradual rise. High GI foods cause a quicker, sharper spike.
Okay.
So for instance, consider this. A small 30-gram slice of white bread. It can have pretty much the same impact on your blood sugar as almost 4 teaspoons of table sugar.
4 teaspoons from one slice of bread. Wow.
Yeah. Or picture a 150-gram bowl of white rice. That can affect blood sugar like 10 teaspoons of table sugar.
10. That's quite striking.
It really is.
Yeah.
Now, compare that to, say, 150 grams of broccoli or cabbage. The impact there is equivalent to less than half a teaspoon of sugar. It truly puts the varying effects into perspective. And this is exactly why opting for whole meal or whole grain complex carbohydrates is generally advised. Things like oats, whole grain bread, whole wheat pasta, or maybe basmati or wild rice, they contain more fiber, which slows down digestion and absorption, leading to that gentler rise in blood glucose we talked about. It's also really important to remember your blood glucose levels aren't just about carbs. They're influenced by your activity level, how your body's producing and using insulin, any medication you're on, alcohol, even your emotional well-being plays a part.
That's incredibly helpful, especially those comparisons. It really paints a clear picture. And what about those diabetic foods, special products you sometimes see marketed specifically for people with diabetes? Are they actually beneficial?
Yes, that's a common misconception. And frankly, it can be a bit of a marketing trap. Foods labeled suitable for people with diabetes generally offer no special benefit. In fact, they're usually not recommended. They're often more expensive, can still be high in calories, and they still have an impact on blood glucose. Actually, in many places, it's against the law now to label foods specifically as diabetic.
Really? I didn't know that.
Yes, it's far better to focus on a healthy, balanced diet using whole, unprocessed foods. Now, non-nutritive artificial sweeteners, things like aspartame or sucralose, they are generally considered safe as part of a healthy, balanced diet. But, as always, moderation is key.
Okay, so understanding carbohydrates is foundational, absolutely. But it's certainly not the whole story. Beyond carbs, what are the other kind of non-negotiables for a T2DM friendly plate? Are there certain food groups we should be prioritizing or perhaps re-evaluating to build a truly balanced approach?
You're absolutely right. It's about building that holistic picture. Beyond mindful carb choices, Focusing on a balanced intake of other essential food groups is vital. Vital for managing T2DM and, crucially, for reducing complications. Let's start with fruit and vegetables. Aim for at least 5 portions daily. They're naturally low in calories, packed with vitamins, minerals, and that crucial fiber. For T2DM, that fiber is key. It helps slow down the digestion and absorption of sugars, leading to that more gradual, stable rise in blood glucose, avoiding those sharp spikes.
Right, better control.
Exactly. And always choose whole fruit over juices or smoothies. Juices lack that beneficial fiber and contain free sugar, which can impact blood glucose more quickly. Think berries, mushrooms, spinach. They're great lower-carb vegetable options, too. Next, protein foods. Things like beans, pulses, nuts, eggs, lean meats, and fish. You want to include these daily. Protein helps with satiety, keeping you feeling fuller for longer. That's a major advantage for weight management. It also has a pretty minimal impact on blood glucose compared to carbohydrates, and can even help blunt the glucose response when eaten alongside carbs. Prioritize those 2 portions of oily fish per week for the heart-protective omega-3s. That's especially important for people with T2DM who have that increased cardiovascular risk. Encourage leaner cuts of meat, and maybe consider replacing some red and processed meats with plant-based proteins like lentils or beans to cut down saturated fat and boost fiber. Then there's dairy and alternatives. Excellent for bone, teeth, and muscle health. Just opt for low-fat, unsweetened versions. And look for calcium-fortified alternatives like unsweetened soy milk if you're going non-dairy. Avoiding added sugars here is important for blood glucose control. When it comes to oils and spreads, the key distinction for T2DM is between those heart-healthy unsaturated fats like olive, rapeseed, vegetable oils, and the less healthy saturated fats found in butter, palm oil, coconut oil. Opting for unsaturated fats supports overall heart health, which is critical, and it might even positively impact insulin sensitivity. Definitely limit saturated fats. And finally, those foods. Foods high in fat, salt, and sugar. Let's be clear, these are not part of a healthy daily diet. They should genuinely be limited to occasional treats. They contribute significantly to weight gain, cause rapid blood sugar spikes, and increase the risk of high blood pressure and heart disease.
So, best avoided most of the time.
Pretty much. Cooking from scratch is a great way to control salt. Use herbs and spices for flavor instead. And water. It's always the best drink choice.
That's a really comprehensive breakdown of the types of foods. Thanks. But knowing what to eat is one thing. Mastering how much to eat, portion control, that seems to be a common struggle for so many people. What are some practical, really actionable tips our listeners could implement, maybe right away?
You've hit on such a critical point there.
Yeah.
Portion control is absolutely central. Central to managing both weight and blood glucose, even if you're eating the right foods. Our sources offer some great practical strategies. For instance, simply using smaller plates. It sounds basic, but it can trick your brain into feeling like you've got a fuller meal.
The old smaller plate trick. It works.
It really can. Also, actually measuring out portions for things like rice, pasta, or cereals, at least initially, can be a real eye-opener. And a smart strategy is to fill half your plate first with low-calorie, non-starchy vegetable salads, leafy greens. This fills you up without adding loads of calories or carbs. From a behavioral standpoint, try drinking a glass or 2 of water maybe 15 minutes before a meal. It can sometimes reduce overall intake. Eat slowly. Remember, it takes about 20 minutes for your brain to register fullness. Rushing often leads to overeating before that signal hits.
20 minutes, that's longer than you think.
It is. Also, avoid distractions while eating. Turn off the TV, put down the phone. Pay attention to your body's hunger and fullness cues, and try to resist the temptation for seconds. Give your body time to process that first helping. Just to give some concrete ideas for portion sizes, think 30 grams of cheese about the size of a matchbox, a palm-sized piece of meat or fish, maybe 2 to 3 tablespoons of cooked rice, pasta, or cereals, 1 slice of bread. These are just guidelines, of course, but they offer a great starting point for more mindful eating.
That's incredibly practical advice, stuff people can genuinely put into action today. So, diet is clearly foundational, but it's part of a bigger, more dynamic picture, isn't it? What other lifestyle elements are essential for managing type 2 diabetes effectively, holistically?
Absolutely. Diet is a cornerstone, but it works best when it integrates seamlessly with other lifestyle factors. Physical activity is hugely important. The general recommendation is to aim for at least 150 minutes of moderate activity per week.
Moderate activity being?
Like brisk walking, cycling, swimming. Something that gets your heart rate up, but you can still hold a conversation. And ideally, spread that over 4 or 5 days. Critically, also break up long periods of just sitting down throughout your day. Even short bursts of movement help. Being active helps your body's insulin work more effectively. That directly improves blood glucose control. It also reduces cholesterol, protects against heart problems, a major benefit for T2DM, helps with weight management, and significantly supports mental well-being. That last one is often overlooked, but so crucial. Beyond activity, seeking professional support is invaluable. Structured diabetes education courses are often free, widely available. Many have online options now, are highly recommended. These courses can give you the confidence and the practical skills you need to manage your condition day to day. And working closely with a registered dietitian, as we've mentioned, is key. They're the experts in helping you identify sustainable and enjoyable changes. Changes to lifestyle, diet, physical activity, all tailored just for you. There are also other supportive avenues, online forums, helplines. Connecting with others going through similar experiences can make a profound difference. It builds a network of support.
So what does this all mean for you, our listener? Let's try and wrap this up. We've talked about the incredible potential for remission through significant weight loss. That's a huge one. The power of embracing a Mediterranean-style diet as your go-to eating pattern. Making smart carbohydrate choices, prioritizing whole grains, understanding their nuanced impact, not just fearing them. Filling your plate with whole foods, mastering portion control using those practical tips, and integrating regular physical activity into your life alongside seeking that professional support. It really seems to be about making truly informed choices, doesn't it? Not about deprivation. It's about building a sustainable lifestyle you can genuinely enjoy and stick with for the long term.
Exactly. And I think what's truly powerful here isn't just knowing what to eat. It's understanding that seemingly small, consistent changes, especially when they're supported by professional guidance, they can lead to monumental shifts in your health. This can potentially redefine what living with diabetes means for you, moving maybe from just management towards true empowerment. So as you reflect on all this information we've covered, maybe consider this. What's just one single realistic change from this deep dive that you feel you could implement this week? Just one thing to start or continue your journey. Remember, knowledge is most valuable when it's understood and applied. And critical thinking is absolutely essential in today's world of information overload.